So I think we start. Good morning, everyone. It's a pleasure to see you for the third day of the conference. I'll be your moderator in the first 90 minutes. And this is a topic very dear to many people. It's at the same time a difficult topic in many respects, and it's a beautiful topic: spiritualities and psychedelics. Ideally, I will have a very minimal talking time today, and we have um, great speakers coming. But what we don't have, unfortunately, is Roland Griffiths speaking, because Roland Griffiths is not in a state where he can even do a remote talk. That's why we asked Professor David Yaden, who is planned for the symposium anyways, to take over part of his time. And now, before we start into the topic of spiritualities, first, one or two remarks from my side, and then an introduction of the speakers, obviously. Like with many people who enter the interesting field of psychedelics and psychedelic therapies, the philosophical or the philosophical spiritual side of the field was always of great interest to me. But you see, by myself using the word philosophical, I also have an attitude. I have myself developed an attitude of a critical review of what people do with spiritualities. This is something I would like to get into our conversation about spiritualities, and we will look at them from a theoretical point, but also with our colleagues from the ZI Mannheim and the Mind Foundation and Charité. We will take a look at patient quotes from interviews that we have. What do people do with spiritualities? What do they do in their lives? Which behaviors are they initiating, changing? Which kind of approach behaviors or avoidance behaviors are situated around spiritualities? Is this healthy, what people are developing? What's the role of the psychotherapist or even ourselves as friends of people who have a psychedelic experience? All these questions can be debated today. So, can I ask the technicians, is Professor David Yaden online already? Yes? Wonderful. So in the first 1.5 hours, we'll have a presentation of David Yaden. Then we have a brief question and answers. And then we will invite Dr. Andreas Weber to give a talk. And then we'll close the first half with a panel. And in the second 1.5 hours, we'll have the presentation of patient quotes that are somehow linked to existential experiences, to philosophies. And we will talk about how that can be interpreted, how we deal with it in psychotherapies and everyday life. It is my pleasure to introduce to you the two speakers of this morning and the colleagues who will be accompanying the dialogue about spiritualities from their expertise as psychotherapists and psychiatrists. So before I introduce David Yaden, I would like to introduce the others briefly so that you know who is also on the expert field. Then I'll introduce David Yaden. So I'll start with Professor Timo Storck. Timo, would you come quickly and tell the audience who you are, what's your background?
Good Morning, everyone, from my part as well. My name is Timo Storck. I work as a professor for clinical psychology and psychotherapy at Psychologische Hochschule Berlin, and also work as a psychologist and psychoanalyst in private practice. And in my research, I am interested in meaning formation in psychotherapy. And that's what I'm going to try and comment the talks we hear about.
Thank you very much. Yeah. So, second colleague with a lot of experience also in providing psychedelic therapy and thinking about the meaning of spiritualities in these therapies is Sandeep Nayak. Sandeep, would you present yourself with a few sentences, your background?
Hello, everyone. I'm Sandeep Nayak. I'm a psychiatrist at Johns Hopkins, where I work on a variety of trials of psilocybin for various psychiatric conditions. So happy to talk about a range of different types of indications and the ways in which these topics arise clinically.
Thank you. So we'll introduce the others in the second part of the symposium. And now it's my pleasure to introduce Professor David Yaden, who is a professor at the Johns Hopkins Center for Psychedelic and Consciousness Research. His research focus is on psychology, cognitive neuroscience, psychopharmacology of spiritual, self-transcendent, and positively transformative experiences that might be triggered by psychedelic substances. So, David, so far I have no contact with you here, but I hope that you could hear what we were saying, and you're invited to give your talk. Well, let's remark. I think it's 4 o'clock in the morning. So, David.
Yes. Thank you for that introduction, Henrik. Can you hear me? I can see you at the podium there.
We can hear you very well.
Oh, good. Yes. Well, I apologize I can't be there in person. I have a newborn here, but it is indeed 3:30 in the morning. So it's bright and early. I'm glad that you can hear me. I'm very glad to be here speaking virtually on this important topic. So I want to begin by noting a new initiative in the field sparked by Roland Griffiths and taken up by him after his terminal cancer diagnosis. So if you look at my affiliation, you'll see that as of a couple of months ago, I'm the Roland Griffiths Professor of Psychedelic Research in Secular Spirituality and Well-Being. I want to say a few words about what secular spirituality means in this context is particularly relevant to the proceedings of this particular symposium. So when Roland received his terminal cancer diagnosis, his priorities shifted in his personal and professional life. Professionally, he came to realize ever more clearly that the most interesting aspects of his research, the outcomes that interested him most, had to do with findings related to the meaning of the psychedelic experience, its spiritual significance, belief changes related to psychedelic experience, and then also persisting changes to well-being, both in terms of mood and attitudes about oneself and one's life. Now, there's this strange word, secular, which is another word like spirituality that means many different things to many different people. So I think spirituality for some people is associated with religious doctrine and is virtually equivalent to religion. For some people, spirituality means something non-doctrinal and vague, but nonetheless dualistic and supernatural, a kind of new age spirituality. And for others, like Sam Harris, for example, but I could cite many examples, spirituality is entirely naturalistic and atheistic and has to do with feelings of connectedness to other people and the world. So spirituality means different things to different people. Secular does as well. For some, secular means the exclusion of the supernatural or religious or spiritual aspects. And so it might seem like a bit of a paradox or a tension to put secular and spirituality next to one another. That's not the sense that's intended here. What's intended is secularity as a kind of standpoint or container. For example, our government offices are meant to be secular spaces in the sense that they allow belief systems of all kinds. They're pluralistic in the sense of allowing any belief system, but not abdicating one in particular. So the idea here is to study all of these senses of spirituality, but from a secular standpoint, not prioritizing one over the other. So let me say a bit more about what I mean there. You can see my speech accepting the great honor of this chair and the mandate to study these topics online. And this is a quote from a recent article. Just reiterating what I just mentioned, that there are indeed different senses of the term spirituality, ranging from religious to atheistic and many gray areas in between, and the importance of conducting unbiased research on these beliefs that doesn't prioritize any particular belief. So I'll say much more about what I mean there. The other thing is to note that these topics attract a massive amount of misinformation, as if it wasn't hard enough to study psychedelics from an unbiased scientific perspective. When you add in topics like spirituality and well-being, we know from social media influencers, the range of statements that are made on these topics is dramatic. And so bringing in scientific and critical thought into these domains that attract so much misinformation seems to me quite important. And that's the mission of this professorship. So a little bit more about where I'm coming from. Like Sandeep Nayak there, I'm a professor at Johns Hopkins in the School of Medicine, the Center for Psychedelic and Consciousness Research. I should note that in that context, in the context of my medical research colleagues, we're often advocating for the value of studying psychedelic experiences and their potential in the therapeutic domain, with colleagues who are generally extremely skeptical of this work. And so when we are in this medical research context, speaking for myself, I find myself advocating for the value of this research against a very skeptical group. However, that's not always the case. When I'm giving talks at conferences like this, I'm often seeing a lot of enthusiasm for psychedelics. And so the roles switch, and all of a sudden I find myself to be in the skeptical position. And so I wrote a paper about this dynamic writ large. It refers to the psychedelic hype bubble. And so I think that we've seen, after periods of exuberance, many decades of extreme skepticism, drug war propaganda against any value of psychedelic experiences whatsoever. And this is a non-evidence-based perspective based on alarmism. And over the past few years, as we all know, we've seen some super enthusiasm. We've seen, especially in the media and perhaps driven by industry interests, but also from some researchers, this super enthusiasm, which goes well beyond the benefit. So I think it's important that we remain evidence-based in our claims generally, specifically with psychedelics because of this pendulum swing or hype bubble dynamic. But the same issues apply on the topics of spirituality and well-being, and maybe particularly as they pertain to psychedelic experience. So a bit of an outline here of what I'll talk about, some background, discuss psychedelic experiences and how they relate to belief changes, and end with some clinical type concerns. So first, the background. I think it's important to note that the kinds of experiences that psychedelics give rise to, as well as psychedelic use itself, has been varied and across historical contexts. But here I'm mostly referring to non-psychedelic experiences that seem to share a similarity to the kind of experiences that psychedelics tend to give rise to. We see evidence of such experiences in every religious tradition, and in prehistory, in ancient Greek history, up to the present day. And so what do I mean by the kind of experiences that I'm referring to? Here's an example. Someone reportedly feeling themselves at one with the grass, all of nature, and feeling the satisfaction of losing self in a perception of supreme power and love. This could easily come from a psychedelic experience. However, this is a Christian woman describing feelings of rapture. And we see experiences of this general kind in most of the world religious traditions, historically and up to the present. However, we also see experiences of this kind reported in books that are very different. These are books all penned by well-known atheists, or maybe agnostics, but mostly leaning atheistic. Bertrand Russell, Sam Harris here, Alain de Botton. There are similar experiences described here, but the interpretation of the experiences is quite different. These experiences are not interpreted as belonging to the realm of revelation or providing support for a supernatural worldview. They're rather described as experiences emanating from the brain, but also tending to have great interest and value attached to these experiences, despite this difference in interpretation. So here's just another example for you to take a look at. Here's Bertrand Russell describing a kind of mystic illumination. He describes this in his autobiography. He says that ultimately he determined that the experience had delusional elements that he came to discount. He did actually find that the experience benefited him for the rest of his life, despite him believing that it emanated entirely from his brain, finding that it brought a kind of closeness to his acquaintances and his relations, and also informing some of his passion and devotion for his life work in pacifism. So there's a concept called bracketing put forward by Husserl, which I feel is undervalued in its use for our purposes. The idea with bracketing is to bracket in a kind of emphasis on the subjective experience and the phenomenal qualities. And this comes from the study of phenomenology. So to focus on the experience itself and to bracket out the interpretations insofar as it's possible to do that. There are deep and interesting scholarly and philosophical questions that may, in some contexts, be empirically tractable, having to do with the extent to which you can really bracket out interpretations from the experience, or whether these color and flavor the experience itself inevitably. But I feel that this is useful as an attempt, and you can get quite far with attempting to do this, to separate out how the experience felt itself versus one's interpretation of it. So to bracket in the feeling of the experience and to bracket out the interpretations. And this is the approach advocated by William James in what I think continues to be a highly relevant and important book, The Varieties of Religious Experience. I'm curious if, by show of hands, how many people have read this book. If you could raise your hand if you've read this book, I'm very curious. I can't actually see you, so I'll have to text Sandeep to see what percentage of the audience raised their hand. So let me say a few things about why I think this book is important and what William James advocated here. First is the emphasis on personal accounts. So rather than simply an armchair consideration of these experiences, he went through and looked at the actual evidence, so people's descriptions of these experiences. He also maintains throughout a methodological agnosticism. You don't know until the last few pages of the book what his own beliefs actually are about these experiences. And he keeps those as personal conclusions rather than professional ones. And so maintaining this secular standpoint or methodological agnosticism has, I think, tremendous value. Outcome-oriented, so looking at what flows from the experiences and emphasizing these outcomes. Henrik mentioned this in his intro. And then evidence-based, finally, looking to the data, gathering the data, and prioritizing the data on these topics. While these topics seem exceptional in the sense that they're highly valued and important, I don't think that they are outside of the purview of the scientific method. And I think we should indeed be leveraging the scientific method to the extent that it's possible. We can look at people's reports and descriptions and their behavior, while we may not be able scientifically to adjudicate the real truth of any metaphysical beliefs or interpretations. This is a book that came out a few months ago from myself and my colleague Andrew Newberg, where we basically attempt to get people to read the original, to read William James's book, and to carry forward insights from that book and review research over the past few decades in psychology, neuroscience, and psychopharmacology on these so-called altered states of consciousness. And we reiterate the points that I just made in this book. A bit on terminology, so I just use this term, altered states of consciousness, which is problematic, I think, because it's so general and vague. I work in a psychopharmacology lab that studies a lot of different drugs, and my colleagues will say, well, each of these different psychoactive substances results in an altered state of consciousness. So what do you mean by altered state? In the psychedelic domain, people are often referring to a psychedelic type experience when they use altered state of consciousness. James coined a number of terms and phrases like stream of consciousness and timeline and others. He comes close to coining the term altered state of consciousness, but he uses forms of consciousness and normal waking consciousness. So at one point, James seems to refer to these experiences in this extremely broad way, as you see here in this quote. But elsewhere, he uses the term religious experience or mystical experience, as you see in the title of the book. I think he does this for reasons of communication. Talking about forms of consciousness is quite abstract, where his readers would be familiar with terms like religious or mystical experience. James does something else that I think is very important, which is he differentiates various aspects of religion and spirituality. So as soon as he uses this term religious experience, he says, what I don't mean by religious experience is the doctrine, the practices, the affiliation, the sociological aspects of going to church, the theology of the beliefs. What I mean specifically are the experiences that some report. And again, he's attempting to focus on the experience while bracketing out the beliefs or the interpretations. And so again, I think this is valuable and a useful way to proceed. He did gather data, and so you see here some very early data gathering on kinds of experiences that people report. These will be non-psychedelic experiences, but you see some of these experiences are culturally constructed, likely in the sense that they're unfamiliar to us. Spontaneous awakening, determination, these are terms that are not common. However, you also see other categories which are quite common. So a sense of oneness, you see here back in the 1890s being asked about. And so this rudimentary work by William James's student Edwin Starbuck that you just saw has been followed up by very large-scale polling companies like the General Social Survey and Gallup. And so here's a sample from the US and UK asking, have you ever felt as though you were close to a powerful spiritual force that seemed to lift you out of yourself? I'm curious if those in the audience would guess what the percent endorsement of this is. So people, how many people do you believe said that yes, they have felt as though they were close to a powerful spiritual force that seemed to lift you out of yourself? So pick a number in your mind of what percent of the population you think has endorsed this question. I'll give you a moment to do that. So once you have a number in mind, just raise your hand to indicate that you have your guess pre-registered. Okay, so there is an answer here. Sometimes psychology can actually provide specific answers. So in this case, there's 40% endorsement here of this particular phrasing. Now, the phrasing has changed over time. It's been administered in many different ways, but it's been surprisingly stable. So ranging from 30 to 40% or so of the population endorsing a variety of questions of this general kind. Like this one, for example, having a profound religious experience or awakening that changed the direction of my life. This one by Gallup, very similar rate of endorsement, as you'll see in a slide or two. This raises an interesting cultural consideration. In the DSM, we see certain quotations like how hallucinations can be part of a normal religious experience in certain, quote, cultural contexts, or in some cultures, having experiences, religious content, here described as a hallucination, is a normal part of religious experience. Well, one wonders what culture they're referring to when you see here's Gallup data over decades showing that the rate of endorsement of having had a religious or mystical experience is quite high, about a third of the US population over many decades endorsing this kind of experience. So you just saw some single item questions, as we call them. Scales tend to work better in most ways because you have a number of probes and you're not relying so much on the wording, one particular word, and one's personal connotations with that word. You get a question asked in a variety of different ways. And so you kind of begin to identify a latent construct that is measured in a more robust way. There are also problems with many existing scales in this area, though, as they don't emphasize experiences. They mix in beliefs and interpretations. And this is an issue. This is a problem for this field in general. I think that we could do more with our methodological agnosticism and more bracketing out interpretations to the extent that we can. If you look into this area, you'll find that in the literature, there are a number of different terms that are used in this context. I've written on self-transcendent experience. We'll see that mystical experience is used widely, oceanic boundlessness by some, ego dissolution. There's quite a lot of terms in this area. For the book that I wrote, we chose the term spiritual experience simply because most people endorsed that that was their preferred term when we asked them. So it is the most common term, as you see here. And actually, mystical is quite more of a rare term when you ask people generally about this general type of experience. However, if you do a subgroup analysis of the data, you'll see different things for those who are believers in supernaturalism or a god, as opposed to those who are considered non-believers, who are naturalists. And you see different preferences in terms of term. And actually, self-transcendent does quite well. So I've been mulling over that as a term that we might talk more about. Also, awe. So both religious and non-religious seem to be okay with that term. Okay, so getting a bit more specific about these experiences, when we look at various triggers of these kinds of experiences, we see right in the middle the psychedelic substance. Actually, we see it right between being near death, so near-death experiences, and childbirth. This is something I recently experienced, at least close by. But we see psychedelic substances are part of this common list of triggers for these kinds of experiences. This is the kind of distribution that I hope that we can begin to show more of. This is, again, more general kinds of experiences, not just psychedelic triggered. But what you see here is that for some people, hospitalization was needed, for some, a lot of therapy, and for others, a little bit of therapy. And so it's important to constantly reiterate the risks and adverse events of these experiences, and that by no means are they all positive. However, it's also important not to fall into pathologization of these experiences. The Freudian perspective was very pathologizing towards these experiences, and I think that view persists amongst some, maybe many psychotherapists and in the normal population. Many people don't want to talk about these experiences because they're afraid that they'll be branded as suffering from a mental illness. So we need to balance our ability to speak about the very real adverse events and negative experiences, but not falling into a pathologization. And even more than not pathologizing, I think we have to acknowledge that many people indeed indicate that they're positively impacted by their experiences. Not all, though, right? So we see some strongly disagree that the experience was positive. So that's part of the distribution. But we also see many strongly agree. So I think we need to learn as a field how to communicate the shape of these distributions, and perhaps find good analogies for the risk-benefit profile of these sorts of experiences. And then the reason why ultimately I went from studying psychology topics that were more generally related to well-being to this topic, you'll see that many people endorse that the experience, which was generally less than an hour, impacted their life for many years. It's very uncommon to find positive experiences that have this lasting impact. So you see in factor 2 here, mystical unity, feeling a sense of oneness with all things. This tends to be what's prioritized and emphasized in psychedelic research, and also in research more generally on experiences of this sort, which we might call spiritual or self-transcendent. However, there are a number of other experiences that are reported at quite high rates, both in psychedelic and non-psychedelic contexts. Aesthetic experiences, revelatory, feeling voices or having visions, synchronicity, feeling that events have a kind of meaning, and even God experiences, which can be had, by the way, by people who don't believe in God. They have an experience that they choose to interpret in a different way. When we do a factor analysis, we find that we can decompose a number of, when we ask people about these experiences, we find a few subtypes. These are by no means comprehensive, but most of the time, if someone says, yes, I've had a spiritual experience, it probably involves either God, unity, or a entity or ghost, a spirit of some kind, which is surprisingly common in the normal population. So there is a deep scholarly debate here that's worth noting. And so there is the view of perennialism, which is that these experiences that I've just mentioned occur across history and across culture and are virtually the same across all of these contexts. I think that we can easily reject naive forms of perennialism that were popular decades ago in the 60s and 70s, for example. It's very clear when you read accounts of experiences across culture that there are genuine differences, not simply superficial differences in language use, but there are genuine differences across cultures and across history. And we need to be mindful of this, to not paper over real diversity with a kind of single view of how these experiences go. The other extreme of this discourse is the idea of cultural constructivism. And this is the idea that experiences are entirely different across culture and that there are no similarities whatsoever. And I think that we can safely reject this as well. There's been very interesting cross-cultural work on pain, showing that pain is a human universal, and rejecting the notion that pain is universal has very dire consequences in medical ethics. While the stakes aren't quite as high here, I think that it's simply similarly naive to think that there are no similarities of these sorts of experiences across culture whatsoever. And so there is this common core view put forward by Hood, which still leans a bit more perennialist, but tries to find some common ground. In my book, we describe a view called the common clusters model, which we think forms even more common ground between the constructivists and the perennialists, and ultimately provides some empirical pathways forward for us to sort out the similarities and differences, which is indeed a project that we're undertaking at Hopkins in collaboration with Harvard, called the Archives Project, where we're gathering experiences, mostly psychedelic to start, across cultures and history. If you're interested in this project, please do email me, and we can add you in as we're opening some aspects of the project to community help. So focusing now on psychedelic experiences more specifically, we do have a real problem with the measurement of the acute subjective effects of psychedelics. I personally think we're fairly early on in this endeavor. There's room for improvement, and I predict that the scales that are used now will not be used 5 to 10 years from now, and my hope is that we'll have far better scales. Here are some examples of the kinds of scales that we have right now. A mystical experience questionnaire is one, challenging experience, the altered states of consciousness scale. So the first two, the mystical and the challenging experience scales, are used at Johns Hopkins primarily. the altered states of consciousness scale used in Switzerland, and I think across much of Europe. Eco-dissolution inventory, often used in the UK. Other scales, including one by myself, the Awe Experience Scale, which I developed with collaborators in California at Berkeley. But really, we use all of these scales all of the time. And while I think each of them, including my own, are problematic and ultimately won't be used in 5 to 10 years, I think that some of the criticisms of these scales are also quite superficial. They're picking up on something. And I think it's important that we continue to refine and to understand what exactly they're picking up on. What is the latent construct that they seem to be identifying? Just a bit of a note here. Again, I think it's just important to continue to reiterate that challenging experiences do happen. Adverse events are real and abuses have occurred. So this is one study. This is not a representative sample, important to note. That is something that we're doing right now. But in a survey of people who reported challenging experiences, 11% reported putting themselves or others at risk, and 2.7% reported getting medical help. And again, adverse events do exist and abuses have occurred. I just want to make sure that I've mentioned these. And I'll continue to reiterate that. And Taves is a religious studies scholar who has made the point that it's important to expand our notion of the acute subjective effects beyond feelings of unity, which can be quite limiting. We've started to do this a little bit at Johns Hopkins. We now ask a wide variety of questions. Here you see examples of psychedelic and non-psychedelic spiritual type experiences, and looking at the extent to which people felt the presence of God and different aspects of what God means in this context. And a similar study for DMT entity encounters. And so I think we are continuing to expand the scope of our measurement of the acute subjective effects of psychedelics. And that ultimately, my hope is that we move as a field into an iterative factor analytic process, similar to how the personality models like the Big Five were derived. And that I hope that this is collaborative and includes both quantitative and qualitative methods that are being pioneered and beginning to be applied in the psychedelic domain. I think network analysis also provides an interesting opportunity here. And so my colleague, Michiel van Elk, is doing important work in this domain. Eiko Fried, and I hope to be working with Michiel van Elk on this project in the very near future. Let's see, before I move on, there's just one other thing I want to say here. So usually I include some correlational scatter plots of the various measures that are commonly used now: the mystical experience, altered state of consciousness scale, ego dissolution. And it's just to say that they're virtually identical. Despite their different theoretical backgrounds, they're basically measuring the same thing. And I think we need to take this quantitative psychometric reality into account when we critique these measures and we say, oh, one is so much better than the other. I don't think there's much grounds for that, frankly. I think they're basically more or less the same thing at this point. Okay, some words on belief changes, and then I'll wrap up in the next few minutes. So there was a debate a few years ago, which seems like a long time ago, but not that long. So Eddie Jacobs from Oxford wrote a piece for the Scientific American, "What if a pill can change your politics or religious beliefs?" He didn't pick this headline, by the way. This was the editor. But myself and Matthew Johnson found the headline concerning and somewhat alarmist. And so we wrote that there's no good evidence that psychedelics can change your politics or religion. And we thought that people would take from the headline this idea that if you take a psychedelic, you have this pretty good chance of coming in an atheist and turning out a Christian, or vice versa, or coming in a Republican and coming out a Democrat. And there's simply no evidence to support that sort of thing. There is some scattered evidence of subtle shifts in beliefs. And since then, Eddie's view has been supported a bit more in the literature. So Chris Timmerman found in survey study, as well as in a clinical trial context, that psychedelics altered some metaphysical beliefs. So for example, this idea that there's a separate realm or dimension associated with supernaturalism. They found that the psilocybin group indeed increased in their non-physicalist beliefs to a small degree. You see also, though, that the SSRI group increased to a smaller degree. And while this is a significant difference, it seems like if the SSRI group is increasing in their non-physicalist beliefs, this may point to something about the context of the study itself that's leading to these changes, or perhaps an interaction with positive changes in affect related to beliefs. But regardless, there's a delta here in the increase that's worth attending to. Sandeep Nayak has also worked on this topic in a cross-sectional self-report survey, looking at a number of more granular metaphysical beliefs, such as dualism, spirituality, and mind perception related to various objects and entities and creatures. Found that these views increased in all but superstition in this cross-sectional survey. So this was more concerning to us. It looked like there was more evidence of psychedelic belief change. However, in a prospective longitudinal study, which is available online, pre-printed, there was no evidence for change in religious or atheistic affiliation, and the changes in mind perception to things like inanimate objects is so small as to be virtually negligible, certainly not clinically significant, but still of genuine interest. And I continue to think that it's important to get the facts in this area. So it seems as if certain contexts seem to be an important active ingredient to changing beliefs, whereas other contexts, we don't see these belief changes. As you see here, from baseline to 2 to 3 months after the experience, there's virtually no changes in terms of believer and non-believer status. And so in conclusion, some clinical concerns that I'll raise. So the World Psychiatric Association does actually say that it's worth discussing a patient's religious and I would say spiritual beliefs and practices. So this is not something that is inappropriate to discuss. In fact, it's encouraged. These are important beliefs and values and meaning-making structures for people that it's worth to bring into the therapeutic container. However, there should not be proselytizing, so pushing one's beliefs or worldview, and here secular is used in the different sense, not as a pluralistic container, but as relating to more atheistic views. So we shouldn't be pushing religious, spiritual, or atheistic beliefs on patients, and I would add study participants. Also, so some believe that spiritual experiences by their nature lend themselves so automatically to a non-physicalist or supernatural interpretation that it's impossible to talk about psychedelic experience in terms other than this sort of religious, spiritual, or supernatural way. But I think Chris Letheby has pointed to very sensible and simple ways of understanding psychedelic experience and discussing them from entirely a naturalistic standpoint, as changes to self-awareness specifically. And I think Chris is right that this provides another option to talk about these experiences. And so some notes about this that I mentioned in my book. I think that clinicians should not promote their own metaphysical beliefs on participants or patients. And by the way, this is not exceptional to psychedelics. This is just general practice. I can't think of a context in which I would not hold this view. Yeah. As well, William James provided a really important set of guidelines and a spirit of methodological agnosticism, which I think that we can carry forward in our research. We should be studying these topics scientifically. They are really important in terms of human sense-making, well-being, behavior. We need good data on these beliefs and how psychedelic experiences relate to them, but a methodological agnosticism is indeed possible. So with that, I want to thank my fellow faculty at the Center for Psychedelic and Consciousness Research, to note that we are engaged in a faculty search. We do have postdoctoral research fellowship opportunities, and I invite you to reach out with criticisms, comments of this talk. So thank you.
Thank you, David, very much for this comprehensive introduction into our topic. Now, I have one concern. If we follow the initial plan to have a question and answers, we will spend 3 hours on question and answers. So I'm inviting you to keep all your questions in mind. I have 20 myself. and to maybe invite the second speaker, which I personally forgot to come to the stage before. Andreas, could you come? And the idea is now the following. We have had an introduction by somebody coming from the therapeutic, from the clinical field with a strong background in philosophy, obviously. You can't talk about these spiritual experiences without that. But now, not everything related to the spirit, to spirituality and psychedelics comes from clinical work. And that's one of the reasons why we invited Philosopher of Biology. And I'm looking very much forward to your contribution, Andreas. But since I forgot to introduce you, could you say a word about your background and then take off with your presentation?
Okay. Yeah.
So we'll discuss David's contribution and Andreas' contribution in the panel that we have together with the audience.
Yeah. So I use this just to forward my slides. Wow,
yes.
Very good. Yeah. Good morning, and thanks, Henrik, for having me here. And well, I started as a biologist, and but also took an education as a philosopher, and I ended up as a writer, basically. So I'm writing books about the idea that the reality is not simply a material collection of objects with the strange human experience of being, of having meaningful experiences, but it is actually alive and experiential to its core. So that's what I'm trying to do and what I'm trying to find. I have been trained with cognitive scientist Francisco Varela in Paris, and have published together with him. So he's my dear teacher, and in the following I'll show you some of his concepts as well. And he was also a Buddhist.
he was a Buddhist following the Dzogchen transmission line by Tulku Udgyen, very famous Dzogchen Tibetan Buddhist teacher. So what I'm going to do here now is to actually, building on this research, on these experiences, trying to argue for, or entice you into seeing that actually life and living experience of being alive, your experience of being alive already is psychedelic. And I try to prove this with some biophilosophical arguments, but I also want to just first invite you into this. So just have a look at this little scenery. So I'm sure many of you will at least a little bit have had some emotional reaction to this picture of the fragile and limited, soon ending summer in the wings of this little lichenid butterfly on this beautiful flower. And this emotional reaction of yours is already part of what I call realizing your own living existence in terms of a psychedelic experience of mutual transformation, and also an experience of unity to which you access on an emotional level, on an emotional plane. That's your reaction, but there's also something which you can observe in terms of what is going on ecologically, namely the flower which is transforming its body into the butterfly by feeding him, and the butterfly who is giving fertility, who's giving offspring to the flower by pollinating the flower. So you have the shifting of shape from one body to another, which is also a psychedelic experience, a very profound one. It is, for me, you'll see in the following, I'm a fan of butterflies, actually. They're very important for me, but not me alone. You see this very interesting etymological connection in Old Greek, where the word for butterfly, psyche, is also the word for soul, and it's also the word for breath. So even there, you see there's a profound insight into the knowledge that our experience of the physical world leads us into our inner understanding of our connection to the physical world. And you see some more of these pictures. Just to remind you that what we'll be talking about, what I'm talking about is actually our daily experience. So this is a nice Apennine spring meadow in May. And you again probably have this feeling, oh, how nice would it be to lie in this meadow and maybe meditate or kiss, what you do in these spring meadows, or eat it like the cows do in this meadow. And again, what you see here is a situation in which one body feeds the other body, and this brings about this diversity and this beauty and this enticement we feel in our souls to somehow become part of this. And I would even say that what we perceive as beauty of nature, as our civilization calls it, is the realization that we are part of this interconnected, mutually transformative network of feeding one another. And as we have heard here in this conference several times, psychedelics enhance this nature connection feeling. So it's actually an enhancement of this understanding of being in a sort of, how could we call it, commonwealth of mutual breath. So I want to stress this, want to explain this a little bit more in depth. So these are my little didactical drawings. And just to tell you what is in depth going on between these different inhabitants or participants of ecosystems. So you see the bumblebee and you see a little flower, and not only, so before I explained you the situation with the butterfly and this other flower as a sort of mutual fertilization, but what actually happens in depth is that we breathe one another. Because if we eat something, if you eat your breakfast of this morning, it is transformed into your body. And then if you breathe out your body, which then feeds other beings. And this is a fundamental ecological situation. So what you see in these, what you see when you, what you even experience here, what you experience when you are among other bodies is always a moment of shifting your shape from yourself into the other and of being fed by the other. Even now when you just turn your attention a little bit to your breathing, you can realize that when you're breathing in the bodies of the persons who sit with you. There's no way around this. The only way around this is to stop breathing. So you have this realization which, without thinking, of a profound biological link, chain link from one body to another, which is actually a sort of continuity, a sort of flux between the bodies. So we could even say that on a material level, we are one huge body, which somehow gives rise to these individuals, which we understand ourselves, but only in a sort of perspectival way, not in a fundamental way, not in an absolute way. And I'll come to that. I come back to that a little bit more specifically. I want to show you that how much this is based on the work of my teacher, Francisco Varela, with this little first lines of a famous article of his, where he talks about organism as a meshwork of selfless selves. So he pursued this idea that we can understand organism only if we understand us, every being, basically as not being an autonomous, sovereign self, but being a self only from the perspective of building ourselves from the matter of others. It has been enigmatic for a long time that he was talking of selfless selves, but it also has this beauteous background of the experience of the selflessness of the world. And I will try to connect this somehow in the remainder of the speech. So the underlying thought, maybe I'll give you this as a little bit as a guideline. The underlying thought in this is, oh no, sorry, we're not. This is the problem when I use my own computer as a manuscript, and it's here, and I'm forwarding the slides on my computer and not on the big screen. Okay, so there's this legendary and difficult article about the selfless self. So the idea is that we can have our subjective experience only because we are continuously remaking ourselves from other bodies, through other bodies. So only because our body is in a total continuum with the rest of the world, we are given our perspective on our experience as somehow being a center of concern of what is going on. So there is an interesting dialectics, and there is also a condition. So only because the world is distributed and shared, we are able to have a perspective on it. So it's not in this view, it is not a contradiction between these two perspectives, but it's actually a condition. Only because the world is totally shared and distributed, we can have a personal perspective on it. And I show you another little, here it is, a little diagram, which illustrates a little bit this term, the famous term of autopoiesis, which many of you might have heard, which has been coined by Varela and his elder collaborator, Maturana, in the 1970s, when they argued that a living being needs to be understood as a circular process which recreates itself from the surrounding, from this incoming matter, from this matter which is eaten and breathed through others and from others, and then is worked into this process of keeping up an identity, and thus creating this perspective, but always being dependent on other, always being dependent on being in this interlinked chain of being in continuity with the rest of the world, with the remainder of the world. And I show you this. Oh, it's here. Go a little bit quicker. I want to show you this again in a sort of scientific way. This is the Krebs cycle, which is the main metabolical cycle in our cells. And just to make you understand that this old idea of living beings somehow taking food, taking stuff in and burning it like a motor does is actually not that which happens in an organism. So the classical idea which you learned in school, or which was somehow suggested when we learned this in school, is that we are machines which need fuel and then burn that fuel, and by the energy which is generated by burning this fuel, keep on going. And what you can see here is, like in the upper left, when you see that it's in German now, food comes in, it becomes transformed into a carbon compound in this citrate cycle, in this fundamental metabolical cycle within the cell, and becomes part of the organism. So what you take up as food becomes your body, literally. And then by breathing out, some parts of this body are released as CO2. So this is actually your body which is released into the air. And this is, so to speak, the biochemical argument for this view that bodies are not firm containers, they are not machines, they are nothing which is just completely closed into itself, but they are processes which run on what they are not. So in being alive, you all the time incorporate what you're not, you become what you're not, and you give yourself away into others. And this then yields this experience of being in this profound emotional connection with others. And let me see where I am. I want to try to link this in, like, maybe the last remaining minutes, 5 minutes. I want to try to link this profound openness and this profound emptiness which comes about through our metabolism, and which has this existential emotional dimension in our experience, as I tried to show you with this, in the presence of this butterfly scene. I want to try to link this to the Buddhist idea of the ultimate ground of reality. I want to make these connections to show you that there is an interesting parallel, actually, between this view of organism as being a continuum that nonetheless creates the perspective on itself through this continuum, and the very old traditional Buddhist ideas of experiencing the ground of reality, or you could also say the nature of the mind. They say the nature of the mind, which is in Tibetan, it's Rigpa. It's the experience of the nature of the mind. And when the Buddhists say mind, they don't mean mind in terms of, like David Chalmers would use it, like in terms of the mind, which is somehow in a not so well understood way related to our physical brain. They refer to the world as such, which is always experience and matter. So this nature of the mind has, and I put there the Sanskrit and the Tibetan terms, is shunyata, means it is full of emptiness. It is empty of self. And there is lalita, which is playfulness. So reality, the ground of reality, is always bringing forth newness. It's always creating something. It is playful, like the first apple blossoms in spring are playing with the light and are playing with fertility. And there is this third very important word, karuna, which is very often translated with compassion. So this is actually the activity of giving. I would translate it as the activity of giving. So the nature of the mind, the basis of reality, is full of, or is actually made of, it is an activity of giving. So that is the, let's say, the Tibetan setup. And then I'll read this and I'll explain it a little bit. And I want, just as a suggestion, I want to try to map these on this idea of the organism I tried to sketch before. So an organism is empty. And I think this was relatively clear in these explanations because it has no fixed material substance. It has no kernel, it has no center. It is continuously passed through by the world and gains the perspective of being an individual only temporarily. So we are in this continuum. And this continuum means that ultimately an organism is empty of self. Ultimately, experientially, it is a perspective, but ultimately it's empty of self. But then, or maybe just to go back, it's the part of emptiness, the part of shunyata. If you look at certain branches of cognitive science and philosophy, and activism, which has been founded by Varela, is relatively common. So people say, okay, yeah, we really basically don't find a self, but and we can work on this. But now I want to go beyond this and show you that we have also the other two in organism, and it might even become more interesting. So lalita, playfulness or luminosity, is something which the ecology, the biosphere, life always yields. And this is part of your experience of this fascination, of this deep aesthetic attraction, of this sensual closeness, of this desire when you see the spring blossom in this meadow that you somehow want to roll in it. And so there's a profound meaningfulness to the ground of reality, which is part of the ground of reality revealed by life. And then karuna, the way to give, which might be the most challenging argument I suggest here on that, has to do with this twist of self-creation of this perspective of meaningfulness, which happens in the continuous flux of matter which goes through the organism. Because if there's a continuous flux of matter, it could also be just matter, just somehow rearranging itself. But in organism, we have this desire, we have this need to build this center, which then always recreates itself, which always gives itself to itself from a desire to create life, or from a desire to self-create as aliveness. So there is a profound level of desire to give life to yourself at your own center. I would call it this, a desire to give life, which forms your own center as an organism, as an own being. And it is the center which forms the center of all beings. And the title of this little talk, which is about to end, Bodies of Love Processes, has to do with the idea that on the level of this flavor of the ground of existence, which is the desire to give life, we are actually within the experience of love, because love is the desire to give life. You know that you're loved by a person when this person shows you that he or she wants you to be alive, wants you to stay yourself, enhancing yourself, growing as yourself. So that's a profound experience of receiving love. It's a good checkup, by the way. Also, if somebody tells you, I love you, and then you see, am I actually given aliveness or not? So this is the core of being an organism, which reforms this this individual self on the matter which rolls through it. It's a sort of desire to give my life to myself. And to my eyes, this is our fundamental experience of being. It's the fundamental sweetness in our hearts, which we know, which every being knows, is that we are given life through the center of our bodies, which is empty, which is just the desire to give life. And going into this desire of giving life, we arrive at the center of reality as well, because reality is this ground which longs for creating individuality, for giving life to individuality. So you could also say that this experience of sweetness of existence, which is given to myself, is a profound psychedelic experience. Or you could even say love is a profound psychedelic experience. And then it also sounds kind of familiar. Like being really in love is also profoundly psychedelic, shape-shifting, body-changing, and connected. Thank you.
So